Hello everyone, and welcome to today's training session. I'm excited to introduce our topic, coronary artery bypass graft, or CABG, procedures, along with the coding guidelines and real-world examples. This is part of our medical coding training module focusing on CABG procedures and ICD 10 PCS coding. Over the course of this presentation, we'll explore the key aspects of performing and coding CABG surgeries, ensuring you have the knowledge to code accurately and confidently. Let's get started. Today, I want to talk about a surgical procedure that plays a crucial role in restoring blood flow to the heart muscle. Essentially, this procedure creates an alternate pathway around a blocked coronary artery, which helps bypass the obstruction and improve blood flow. By doing this, we can significantly enhance the oxygen supply to the heart muscle, which is vital for its proper function. This procedure is known as CABG, or coronary artery bypass grafting. It's a well-established technique that provides relief for patients with severe coronary artery blockages, helping them regain better heart health and reduce symptoms like chest pain. Understanding this procedure is key to appreciating how we can effectively treat coronary artery disease and improve patient outcomes. Let's take a closer look at this illustration of the heart's anatomy, specifically highlighting the coronary arteries. As you can see here, the coronary arteries are essential because they supply oxygen-rich blood to the heart muscle itself. In the context of CABG, or coronary artery bypass grafting, understanding this anatomy is crucial. The procedure involves creating new pathways around blocked or narrowed arteries to restore proper blood flow. So, in this diagram, you'll notice the areas where blockages might occur and how grafts are positioned to bypass these obstructions. Recognizing these key points helps us appreciate the significance of the surgery and how it aims to improve heart function. Remember, the overall goal is to ensure the heart muscle receives the blood it needs to keep the patient healthy and active. Let's take a closer look at some of the key issues related to coronary artery disease. When the disease affects the left main coronary artery, it can cause significant problems because this artery supplies a large portion of the heart muscle. Left main coronary stenosis, or narrowing of this artery, is a particularly serious condition that often requires careful management. In cases where multiple vessels are involved, we talk about triple vessel disease, which means 3 major coronary arteries are affected. This widespread involvement can make treatment more complex, but also highlights the need for more definitive interventions. Sometimes, patients have already undergone procedures like angioplasty or stent placement, but these interventions fail to provide the desired results or the disease progresses. In such cases, we have to consider alternative strategies, like coronary artery bypass grafting, or CABG. Now, the key point here is understanding when CABG becomes the recommended approach. It's generally indicated when there's significant left main disease, extensive multivessel disease, or failed previous interventions. Recognizing these indications helps us tailor the best treatment plan for each patient, aiming for improved outcomes and quality of life. Let's take a closer look at the CABG surgical procedure with this diagram. CABG stands for coronary artery bypass grafting, and it's a common surgery used to improve blood flow to the heart muscle. Essentially, when the coronary arteries are blocked or narrowed, this procedure creates a new pathway around the blockage. The diagram illustrates how a healthy blood vessel, often taken from the leg or chest, is grafted to bypass the obstructed artery. You can see how the graft connects to the aorta and then reroutes blood past the blocked section. This procedure is crucial because it helps restore proper blood flow, reducing symptoms like chest pain and decreasing the risk of a heart attack. It's a key example of how surgical intervention can significantly improve cardiac function and patient outcomes. In the context of our overall presentation, understanding CABG highlights the importance of surgical options when medical management alone isn't enough to control coronary artery disease. Now, let's look at how we can alter the route of passage of blood. Essentially, this procedure allows blood to bypass an area where there's an obstruction. The main goal here is to reroute the blood flow so that it can continue to circulate effectively, despite blockages. This is classified under the route operation called bypass, according to ICD 10 PCS coding. When we say bypass, we're talking about creating a new pathway for the blood to travel around the problem area. This concept is crucial because it helps us understand how certain surgical procedures address circulation issues by rerouting blood flow, which is a common intervention in many vascular conditions. By grasping this, we can better appreciate how different procedures are categorized and documented in the medical coding system. Now, let's take a closer look at how this code is structured. We start with a section, which in this case is medical and surgical, indicating the broader category of the procedure. Moving on, the body system involved is the heart and great vessels, which tells us we're focusing on cardiac structures. The route operation here is bypass, meaning we're performing a bypass procedure to reroute blood flow. Next, we specify the body part, which refers to the number of coronary arteries involved in the bypass. This helps specify exactly what part of the heart we're working on. The approach used is open, indicating that the surgery is performed through an open incision. The device refers to the graft type, meaning the specific material or conduit used to create the bypass. Finally, the qualifier, which is the source vessel, provides additional detail about where the graft is coming from, giving us a complete picture of the procedure. All of these components together form the PCS code structure, which is essential for accurate coding and documentation. Understanding how each piece fits helps us communicate precisely about the procedure and ensures proper coding for billing and record keeping. Let's talk about how we categorize bypass grafts based on the arteries they are connected to, rather than just the number of grafts. For example, if a patient has grafts to the LAD, RCA, and circumflex arteries, we refer to this as 3 arteries being bypassed. This approach helps us understand the scope of the coronary disease more clearly. When selecting which arteries to bypass, it's important to focus on the specific arteries involved, since this guides our surgical planning and ultimately impacts the patient's outcomes. Remember, it's not just about counting grafts, but about targeting the affected arteries directly. This method ensures we're addressing the key areas of coronary blockage effectively, aligning with the overall goal of restoring proper blood flow to the heart muscle. Let's talk about the types of grafts we commonly use. First, autologous arterial tissue, such as the lima and RIMA, which are the left and right internal mammary arteries. These are often preferred because they tend to have better long-term patency and lower risk of complications. Next, we have autologous venous tissue, with the saphenous vein being the most typical choice. While it's more readily available and easier to harvest, it may not last as long as arterial grafts, so we consider this when planning the procedure. When arterial or venous tissue isn't suitable or available, we sometimes opt for a synthetic substitute, such as artificial grafts. These are useful in specific situations, but usually have different implications for durability and compatibility. Finally, selecting the right device is crucial. The device character, meaning its size, flexibility, and compatibility, plays a key role in ensuring a successful graft. It's about choosing the right tool for the specific tissue and patient to optimize outcomes. All these choices are interconnected and align with our overall goal, providing durable, effective revascularization tailored to each patient's needs. Now let's take a look at slide 10, which focuses on identifying the blood source vessel. As you can see, there are 3 main options here: A, the aorta, B, the internal mammary, and C, the radial artery. When we're selecting a vessel for a procedure, it's crucial to understand the origin of the blood supply, as this impacts both the approach and the expected outcomes. The aorta, being the main artery leaving the heart, is often a primary source because it supplies a vast network of vessels. The internal mammary artery, located along the chest wall, is commonly used in coronary bypass surgeries due to its reliable blood flow and ease of access. The radial artery, which runs down the forearm, is another popular choice, especially for less invasive procedures. When making a choice, it's important to consider the specific clinical context, the quality of the vessel, and how well it can meet the demands of the procedure. This decision process is a key part of the qualifier selection, ensuring we optimize the patient's outcome by choosing the most suitable blood source vessel based on these factors. Today, I'll walk you through the procedure of a lima to LAD bypass, which is a common and effective method for coronary revascularization. The key point here is that we're using the internal mammary artery, specifically the left internal mammary artery, or lima, to bypass the blocked or narrowed section of the LAD, or left anterior descending artery. This approach is favored because of its durability and excellent long-term patency. When we look at coding, the example PCS code for this procedure is. This helps ensure accurate documentation and billing. To give you a concrete example, the lima coding example shows how this procedure is classified and billed, highlighting the importance of precise coding for reimbursement and record keeping. Overall, understanding this procedure and its coding is essential because it's a staple in coronary artery bypass grafting, and it underscores the importance of using internal mammary arteries for long-term success. Let's walk through the procedure from RIMA to RCA. First, we focus on using autologous arterial tissue, which means we're utilizing the patient's own artery, ensuring better compatibility and longevity. Next, an internal mammary qualifier is applied. This step is crucial for assessing the quality and suitability of the internal mammary artery before proceeding. We then look at a RIMA coding example, which helps us understand how to document and interpret this specific procedure accurately. Overall, these steps are integral to ensuring a successful graft, leveraging the patient's own tissue for a more durable outcome. This process highlights the importance of careful assessment and precise coding in achieving optimal surgical results. Now let's talk about graft types and how they relate to PCS codes. Different graft types actually require separate PCS codes, so it's important to code each type correctly. For example, arterial grafts and venous grafts are coded independently of each other. This means you can't use a single code for both. Instead, each has its own specific code. Additionally, there's a special rule called the mixed graft coding rule. This rule helps guide you when a procedure involves both arterial and venous grafts in the same operation. It ensures that you assign the appropriate codes for each graft type, reflecting the complexity of the procedure. Understanding these distinctions is key to accurate coding and billing, which ties back to our overall goal of precise documentation and reimbursement. Let's now talk about some key aspects of cardiopulmonary bypass, specifically slide 14. First, vein harvest procedures are an essential part of many cardiac surgeries, especially when we're preparing for bypass. The saphenous vein is commonly used, and careful harvesting is crucial to ensure the best graft quality. Next, we have valve repair or replacement. Depending on the patient's condition, we might repair a damaged valve or replace it altogether. This step is vital for restoring proper heart function and improving patient outcomes. Intraoperative transesophageal echocardiography, or TEE, plays a significant role here. It allows us to visualize the heart in real time during surgery, helping us assess the effectiveness of repairs and detect any issues immediately. Finally, there are additional procedures that can be performed alongside CABG, such as addressing other cardiac abnormalities or performing septal repairs. These combined approaches help tailor the surgery to the patient's specific needs, ultimately aiming for the best possible recovery and long-term success. Connecting all these points, it's clear how each component contributes to a comprehensive and effective cardiac surgical strategy. Let's talk about coding based on artery count. When you're assigning codes, do not code coronary occlusions separately. Instead, focus on the artery count to reflect the extent of disease. It's also crucial to assign the qualifier carefully to ensure accuracy and clarity in your documentation. Referring to the AHA Coding Clinic Key Guidance can really help clarify these nuances. Remember, the key is to accurately represent the patient's condition without overcomplicating the coding process. This approach not only aligns with best practices, but also supports consistent and reliable data collection. Overall, these points tie back to our theme of precise and thoughtful coding, making sure we capture the complexity of coronary disease without unnecessary duplication. Let's talk about some common coding errors that can trip us up. First, coding per graft instead of per artery. This is a frequent mistake because it's important to identify the specific artery involved rather than just the graft as a whole. Next, missing qualifier characters can lead to inaccuracies. These characters are essential for providing the detail needed for correct coding. Then, there's the issue of not coding the harvest procedure when it's applicable. Omitting this step can result in incomplete documentation and potential coding discrepancies. Overall, these errors highlight the importance of paying close attention to detail and ensuring each component is accurately captured. Staying vigilant about these common pitfalls helps us maintain precise and compliant coding practices. Now, let's look at our final scenario involving CABG, or coronary artery bypass grafting, performed 3 times using both the left internal mammary artery, or LIMA, and the saphenous vein graft, or SVG. First, it's important to assign the correct arterial and venous bypass codes to accurately reflect the procedures performed. This step ensures our coding is precise and compliant with guidelines. Next, don't forget to include the coronary bypass and harvest codes. These codes capture the harvesting of the grafts as well as the bypass procedures themselves, which are both essential for complete documentation. Finally, by completing this coding scenario thoroughly, we reinforce key concepts about how to approach complex cases involving multiple grafts and different harvesting techniques. This example ties back to our overall theme of understanding comprehensive coding for cardiac procedures, emphasizing the importance of meticulous documentation and correct code assignment. Now, let's wrap up with the key points on this final slide. When documenting a bypass procedure, we start by identifying the root operation, which in this case is bypass. Next, we specify the body part involved, meaning the arteries that were bypassed during the surgery. It's important to note the device used, which is the graft type, as this provides details about the materials employed. We also need to include the source vessel, serving as a qualifier to clarify where the graft was connected. Additionally, if there were any other procedures performed alongside the main bypass, these should be reported as well. To sum up, this slide emphasizes the importance of thorough documentation, covering the root operation, the specific arteries involved, the graft used, the source vessel, and any additional procedures. All of these details help ensure clarity and accuracy in coding and reporting, linking back to our overall goal of precise surgical documentation.